I am excited to continue our day of conversation. Joining me now, I've got Dr. Ariel Becca from Striped, who is doing some amazing research and work into monitoring eating disorders, understanding eating disorders, and hopefully being able to identify some ways that we can prevent eating disorders in the future here. So, Dr. Becca, would you like to go ahead and introduce yourself?
Yes, hi. Thank you so much for having me. Yeah, I'm Ariel. I use she, her pronouns, and I am a research scientist based at Boston Children's Hospital. And I work with STRIPED, which stands for the Strategic Training Initiative for the Prevention of Eating Disorders. I'm an epidemiologist by training, and my research focuses on understanding how eating disorders manifest across populations. So, really looking at which groups of people are more or less likely to be affected by an eating disorder and why, with the ultimate goal of developing preventive interventions.
Well, thank you for the work that you're doing. And I know that one of the areas that you're involved with is with the CDC's Youth Risk Behavior Survey. So could you maybe tell us a little bit more about that and the importance of that when it comes to eating disorders?
Absolutely, yeah. So the YRBS stands for the Youth Risk Behavior Survey, and it is a big nationwide survey of youth health, behaviors, and associated risk factors. And it's conducted by the CDC in partnerships with local health departments and schools. And it's really the number one source of information that we have on youth health in the US. So the YRBS is relevant to eating disorders for a variety of reasons. From around like the early 1990s through 2013. It included three items that were relevant to eating disorders. It was items asking about purging behaviors, fasting or chronic dieting, and diet pill use. And that represented pretty much the only source of regularly collected, nationally representative data on eating disorders. And that's really important to many people. It's important to folks in public health so that we can track eating disorder prevalence over time and know which groups of youth are more or less affected. Also know if there's any spikes. We can know if there's inequities. So certain groups, particularly marginalized groups, may be disproportionately affected, and we can track that and look at why that may be the case. It can be helpful for clinicians and folks in healthcare to know, are you working in a place where eating disorders are spiking right now? Where do we need to allocate resources? And of course, researchers rely on these data to do all sorts of work, understanding the drivers of eating disorders and what we can do to develop interventions. So I said that they were collecting these data through 2013. That is because after that, starting with the 2015 survey, they took out those three items. And there's a multitude of reasons for this. Basically, the survey has to remain a certain length because it's administered in schools. So it has to fit into a 45-minute school period. So when there's new emerging health issues, something has to get taken out. And it's not always very clear what gets taken out and why. But yeah, eating disorder items got taken out. So since 2013, we have not had any source of nationally representative data on eating disorders. That means throughout the pandemic, we have not had data, representative data on eating disorders. We've been relying on hospital data and data from emergency departments, which of course gives us some of the picture of what's happening, but not the complete picture, right? Because now it's just data on individuals or kids who are already at a pretty extreme state with their eating disorder. So Striped has been really, really active pretty much right off the bat since 2013 in advocating for the re-inclusion of these items back into the YRBS. And in 2019, I think, or around 2020, we formed a working group. We call it the Eating Disorder Surveillance Working Group. And it's comprised of Striped researchers like myself, but also YRBS coordinators working in state health departments across the US. So we have representation from states like Alaska and Kentucky and Vermont, so really all across the US, and also folks working, on the ground in public health or in clinics. And we tried to push this effort even further because, we were seeing during the pandemic that eating disorders are spiking, and it just seemed, a bit wild to us that we didn't have the data that we needed to be able to really track this. And so we pushed year after year to try to get these items included. And for the 2025 survey, we were successful in getting an item to assess binge eating added to the national survey, and also an item assessing restrictive type eating behaviors, which will be on an optional question list that states can use to pull from when creating their own state-specific surveys. So that was, of course, a really big win, and we're very excited about that because it will mark the first time in over a decade that data will be collected on eating disorders.
That's amazing because that was one of the questions I was going to ask you is just it feels like eating disorders are so prevalent and we know that
Mhm,
based on the
mhm,
limited research we have, but it
mhm,
just feels like the data that's out there and the research that's out there doesn't match
mhm,
the prevalence that
mhm,
we have when it comes to eating disorders.
mhm,
And especially since the pandemic, because I think
mhm,
everybody's heard, yes, we've seen increased cases of eating disorders and increased cases of mental health concerns since the
mhm,
pandemic, but we don't really have a lot of raw numbers on that or any,
mhm,
things
mhm,
that we can specifically point to. So that's incredible now that we'll be able to start to get that data and that information in. I'm
mhm,
curious, once the 2025 survey is done, how long does it take for your team to start reviewing that information and maybe start to
mhm,
find some trends or some of the I guess yeah, find the trends in
mhm.
the summary of the results?
That's a really great question. I guess for context, the 2023 survey, those data were just made public within this year. So about, a year and a half later.
Mhm.
And so in addition to there being a national YRBS survey, each state that participates in the YRBS, not all states participate, but most do, they also administered their own state-specific survey. And as a strategy to try to get the national survey to add eating disorder items in, we first focused on states. And so a handful of states included this eating disorder measure in their 2023 survey. So right now we're analyzing those data because they just became available for us to start to look at. And some of these data will be public. Like I know Alaska, their YRBS, they included two eating disorder items. And I believe that that's public data. So yeah, we're analyzing that right now. So for the 2025 survey, it'll be, probably end of 2026
Mhm.
that we'll be able to get, yeah, some of the first representative estimates of these behaviors.
Yeah, well, that'll be great to have. I guess I know we're early on and you've only had some of the state information,
Mhm.
but have you noticed any trends or any
Mhm.
changes in the data that you
Mhm.
are looking at now?
Yeah, so we've dug into the data for two states so far. Um, and the results are simultaneously very alarming, but also unfortunately consistent with what we saw from like the hospital data, the emergency department data, which were suggesting some big spikes. So we're seeing a prevalence of so for the behaviors of binge eating and restrictive eating, a prevalence hovering around 32% of youth overall reporting engaging in these behaviors. So around one third of youth, which is extraordinarily high. But what's also very concerning is that's the overall prevalence. When we start to look further at subgroups and looking at patterns by gender, for example, or by sexual orientation, we're seeing much higher prevalence among LGBTQ youth. If we look by racialized identity, we're seeing higher prevalence among youth of color. Prevalence is up to around 50%. So around half of youth belonging to some marginalized group reporting engaging in disordered eating, which is, of course, a major, major public health concern.
Yeah, that's heartbreaking to know that there's so many.
Absolutely.
And this is just from, the data. There's probably more out there because of the stigma that we're not even able
Mhm,
to reach or to get to talk about these
mhm,
things. And it's
mhm,
just it's heartbreaking to know this. And it's what kind of drives a lot of our organizations
mhm,
out there to raise awareness on high school and college campuses.
mhm,
Here at ANAD, we launched our ASAP program in the fall. And it's targeted at making sure that high schoolers and college students know that there are resources out there and there's available
mhm,
treatment options
mhm,
because unfortunately we know it's happening even if we don't
Mhm.
have the specific number or know the exact trends, it is happening.
Absolutely.
And I'm curious if you could maybe dive a little bit more into the inequalities. Like, do you know like what could be fueling this? Why are we
Mhm.
seeing higher rates in marginalized communities? Or maybe what could be done to better
Mhm.
collect or understand what maybe an LGBTQ youth experiences compared
Mhm.
to a straight identifying youth?
Mhm. Yeah, really good questions. So in terms of why we're likely seeing these inequities, there's a variety of reasons. Ultimately, it comes down to the stigma and discrimination experienced by marginalized youth. So there has been research on the limited data that we have, but we also know from community orgs and people with lived experience that things like discrimination, stigma, victimization, food insecurity, all of those are strongly, strongly associated with eating disorder risk among marginalized youth. Eating disorders can often be used as coping mechanisms to deal with stress and trauma and all of these adverse social experiences. Eating disorders are very strongly associated with trauma, can be a trauma response. So that is likely the root cause is, structural and social forms of discrimination. And in terms of your second question, like what data do we need? Representative data will allow us to actually estimate the magnitude of these inequities, which can be really, really helpful for going to policymakers or going to community groups and talking about the need for health equity interventions that focus on eating disorders. But it will also allow us to look at some of the drivers because in, for example, the YRBS, there's data on things like experiences with racism, experiences with housing and food insecurity. And so we can start to look at the links between those experiences and eating disorders and provide concrete evidence in order to inform interventions. But then also something like that you can do with these big representative data sets is also link them to data on even like higher up or more upstream factors. So things like state policies. So like in my own work, I'm really interested in looking at how discriminatory state policies related to gender and sexual orientations, like anti-LGBTQ policies, how that's influencing eating disorder risk and inequities experienced by LGBTQ youth. And again, that's just important evidence that you can use in activism and advocacy efforts to bring to policymakers to say, hey, look, these policies are so harmful to mental health, including eating disorders. We need to, do something about it.
Yeah. I'm curious if somebody's listening right now and they have lived experience with an eating disorder. We have a lot of amazing volunteers here at ANAD who provide that peer support. How can they get involved? Like, how can they help assist when it comes to getting this data or participating in studies or surveys? Because their lived experience could really help other people. So, I'm curious if there's ways that they could get involved.
Absolutely. Well, anyone who wants to get interested in data advocacy work for eating disorders, you are always more than welcome to reach out to me. We are a very small group. Our working group is very small, and we always welcome folks, including folks with lived experience, to help us with our efforts. I can maybe send you the link to our website where we have a form for folks who are interested in getting involved in any capacity to let us know, and we can invite you to our group and our meetings. And we also have a ton of resources on our website as well for eating disorder data advocacy. I will also say outside of our group, really reaching out to your elected officials and letting them know that eating disorder data is important and needed in your district and your state because our elected officials have power when it comes to what kind of data is being collected in our public health surveillance systems. We're of course seeing that now more than ever with the ongoing and current attacks on our public health system right now. And so this is very much something that is on our elected officials' officials' mind. I know I've been reaching out to my elected officials almost daily to talk about broadly, the removal and the purging of data sets, public data sets as it relates, especially to gender data right now. And I've been talking about how this impacts our work in the eating disorder field. Yeah, definitely reaching out to elected officials, I think, is the number one thing you could do right now.
Yeah, and our friends at Eating Disorder Coalition do amazing work in terms of
Yes, yes.
advocacy and helping people. So
Hmm.
if you're not sure, like how to start that email or to start that
Hmm.
letter, to go knock it on your representative's door, like there
Hmm.
are tools and resources out there to help you with that.
Absolutely. And Striped has actually a really great resource on our website. It's called the Advocacy Playbook. And it basically walks folks through how to get involved in advocacy on any issue related to eating disorders, including, scripts for talking to lawmakers or sending emails and making calls, and just walks you through the process. So I still use that as someone who's been doing this work now for many years. So it's extremely helpful.
Oh, that's amazing. Yeah, I'll make sure to include. So if you're watching right now, you'll receive a follow-up email if you've registered. So
Mhm.
if you registered, we'll make sure to include a link to that playbook because that would be
Mhm.
incredible, as well as the form to get in touch with you for more details on how to get involved. Um,
Yes.
I'm kind of curious, kind of shifting gears here just a little bit.
Mhm.
I have in my mind just this kind of mission control center, when you talk about the public health surveillance and
Mhm.
monitoring the trends that are happening. How does monitoring and surveying and collecting this
Mhm.
data help in terms of prevention efforts?
Mhm.
And kind of where is the connection there and the bridge there?
Yeah, really good question. So a phrase that is often used in public health is like no data, no problem. So essentially that means if you don't have data on something, it feels like it's, out of your mind. It's not an issue, but that of course couldn't be further from the truth. It's just really going to make the problem worse because you're not going to be able to address it. So public health monitoring and surveillance is really central to prevention. It's kind of the first step. So we need to know, for example, overall, how many youth or how many individuals in the US are affected by eating disorders. But then we need to dig a little bit deeper because, our prevention strategies are often a bit more targeted. So we want to know where should we be allocating resources? What setting should we be allocating resources? Should it be schools? Should it be clinics? Should it be on sports teams or somewhere else? Is it a certain region of the US that's maybe being more hard hit than another region within a state? Is it, in cities or in rural areas or all of it? And then, of course, you also want to know, like we've been talking about a lot, is inequities. So are certain groups disproportionately affected? And how can we then make sure our interventions really have an equity lens to make sure that we're not inadvertently exacerbating those inequities by not centering those who need the resources the most. So that's where data comes in. It provides that picture of who's affected, when they're affected, and it can also allow us to look at the links between eating disorders and some of the probable risk factors. So like I said before, as an example, the YRBS collects data on food insecurity. We can start to look at the relationships between food insecurity and eating disorders. And we can say, or we can ask questions like, is food insecurity explaining why youth of color or LGBTQ youth have a higher rate of eating disorders than their non-marginalized youth? And if that's the case, then we can start to say, okay, what does an intervention that is going to address and fix food insecurity, what does that look like? So it's really, yeah, it's that first step. And it's giving us clues as to what we might want to focus our prevention strategies on.
Amazing. Amazing. And what can like parents or educators or
Mhm.
other organizations do then if we start to notice that there's
Mhm.
a spike happening in a certain region or a certain area? What kind of
Mhm.
things can we do on the ground, I guess, to actually
Mhm.
start to boost those prevention efforts?
Yeah, absolutely. So for parents, and then also for educators, I would say that getting educated on eating disorders is really an important first step, especially now since we know that there are such big spikes among youth. There are really so many misconceptions still about what an eating disorder looks like, who's more or less likely to be affected, and even if you're not trying to hold these misconceptions, they can creep in and maybe bias who you think in your classroom or among your kids may be most likely to be affected. So knowing the early warning signs, what they look like, and how it may not be this stereotypical image of an eating disorder is really important. And knowing that any kid can become affected by an eating disorder is important, and that's definitely a first step. In terms of some concrete advice, we know from a large body of research that really shifting away from and really avoiding weight-centric messages and talk around food and bodies is so important. Comments about weight and physical appearance and food can be really detrimental to a kid's mental health, physical health, and really focusing on developing more of a healthy relationship with food and with one's body is going to have so much bigger of a positive impact on health in the long run. So focusing on mental health, focusing on self-care, all really, really important. And then, of course, knowing when and how to get help for an eating disorder. This can mean talking with, your provider, your healthcare provider, but it can also mean knowing that there are other, amazing resources and organizations like yours available to connect folks to resources, and that, yeah, help is definitely available. And then in terms of organizations, kind of writ large, there's so many different protective policies and programs that are out there. So, just as an example, like in schools, for example, schools can implement screening programs, media literacy programs to kind of get at the social media component, since we know social media is also linked with eating disorder risk, avoiding things like BMI report cards, which there's a lot of research showing how harmful that can be. And really also focusing on some of those social determinants that are likely to be increasing risk, particularly for marginalized youth. So things like, bullying prevention programs, working to address food insecurity among student populations, all of that really important.
Yeah. Amazing tips for everybody. That I think we've all can at least come away with this conversation with one tip we can do in our own community to help, stop eating disorders from being so prevalent and just so dangerous.
Mhm.
I've got a quick question. I've got one more question here before we wrap it up. But before I get to that one, I'm just curious, has your team ever been able to identify perhaps any spikes in eating disorders following like a major natural disaster or something? Like I think
Mhm.
about how we've had the hurricanes as of late or the wildfires in
Mhm.
Southern California, and I know it's too early to have data there, but I'm
Mhm.
just wondering if that's ever been something that's on the radar to study
Mhm.
to see if perhaps traumatic events like that unfold can then, lead to a spike in eating
Mhm.
disorder cases.
That's a really, really excellent question. And my short answer is we don't have that kind of data.
Mhm.
That being said, is that an absolutely important question to ask? Yes, because we do know that big traumatic events are associated with spikes in eating disorders, like we saw with COVID. And we know also from other mental health conditions, things like, calls to suicide crisis lines often spike after big events like COVID, but also natural disasters and other traumatic events. And so I would hypothesize that eating disorder risk also spikes during that time. But we don't have those data, but we need those data. Yeah.
Yeah, it's just an idea that kind of popped into my head.
Yeah.
I was
No, it's
just
an
thinking because
excellent,
it,
excellent
yeah,
question.
yeah, definitely top of mind. And I guess that does lead into
Hmm.
my final question, which is what does the future hold for your
Hmm.
team and for the work that you're doing right now? What's coming up for
Hmm.
you?
Yeah, of course. I mean, my focus right now is really ensuring that we get more and better data on eating disorders, especially inclusive representative data. in terms of striped as a whole, and also kind of what I'm thinking about broadly for the field. I really do think that there needs to be an enhanced focus on some of these social and structural drivers of eating disorders, so that we can start to develop really large scale prevention efforts, but also health equity efforts to address inequities. And so that can mean a variety of things. I talked a little bit about my interest and focus on state policies, and kind of the broader social and political environment. It can also mean focusing on social media, but really not just individual use, but the algorithms and the associated business practices that are, prioritizing profits over user well-being. Of course, there's things like, the diet and beauty and wellness industries, and how those industry practices are also contributing to a really toxic environment surrounding food and the body. So yeah, I think more research that Striped is, really, really trying to be a leader in, but more research on those structural drivers so that we can inform kind of policy-oriented prevention efforts.
Well, I just want to again thank you for the incredible work that you're doing because it is so, so, so needed. And we need to understand eating disorders more and have this type of knowledge and data. And I think it will go a long way in one, preventing eating disorders, but hopefully reducing the severity too. If an
Mhm.
individual does experience an eating disorder, perhaps, a better understanding of warning signs can
Mhm.
help lead that individual to treatment at a much earlier stage. So,
Mhm.
thank you for the incredible work that you're doing. And
Thank you.
again, everyone, I will share some resources to get in touch
Mhm.
with Striped following our
Mhm.
conversations today. And again, just thank you so much.
Yeah, thank you so much. And thank you for all the work that you do as well. It is so important and needed.